Ladies, gentlemen, and children of all ages, this is Bill Cephakar. I'm here with episode 2 of One Human, One World, One Health, which is part of the IBMS program, the International Board of Medicine and Surgery. And last week we had episode 1, Dr. David P. Kalin, director and founder. And this week it gives me extreme distinct pleasure of having the other part of IBMS and One Human, One World, and One Health, the very radiant and special lady of the world, Hyon Kalin. Now, before we have her chance to explain what the mission is of the Hope Museum, I just would give you a little more background. As I said, the International Board of Medicine and Surgery has contributed for 17 years to deal with the most needy among us by humanitarian distribution, donations of medical, surgical, dental supplies, medications, instruments, equipment, and services. It showcases innovative medical, surgical, dental procedures, treatments, technological equipment, and pharmaceutical therapy through IBMS Global. But the third part of the special 3-part mission is developing the Hope Museum as an international women's museum with the goal of understanding the history, art, and science of women. It gives me great pleasure, and I know this woman for over 20 years. Her and David Kalin have worked together as a team to accomplish amazing things. Hyon Kalin, thank you for gracing our stage in the studio here.
Hello, my name is Hyun Kalin, wife of David Kalin, and we initiated Hope Museum a while back, but unfortunately, my limited resources or couldn't find many people's help, so it didn't take off that far. So we're looking for 40 board members of a Hope Museum. That way we can,
Initiate and
initiate
pay
to the
for this.
museum and then go forward from now on. We need a very powerful and enthusiastic and professional women. Even men are welcome if they want to, you know, go forward with our dream and together.
Now, how did you get into this? Why are you taking this banner and running with it? Because half of the women, half of the people on this planet are women, and they're women in need of care and help. And this is something that you've been working on for so many years.
Well, first of all, my background in mountain village in Seoul didn't have much. I grew up that way
South Korea,
in
is that
South Korea. And second of all, I happened to have a kid when I was 47 years old. It wasn't easy. It was very hard journey, but I learned third countries doctors are amazing as American doctors, and cost of a procedure was a lot cheaper. And top of that, when I was in South Korea trying to have a baby, that's what we got son. And whenever you walked in the doctor's office, it was amazing. They treated patient like a king and queen. In America, for instance, I couldn't even get a day off for my procedure, and then you know I needed to rest. I needed to take some time off. They wouldn't allow me.
and,
Anyway,
and you weren't
all
too successful with 3 attempts here in the United States with in vitro and one in Venezuela that was also not successful.
no, it wasn't the case. In Venezuela, I had to reimburse my tube tie, but in vitro, I failed almost 4 times in America. I didn't realize out there a lot of women over middle 30s, they want to have a child, but they're too late. And then they have to go through the in vitro route, but it was very expensive procedure. And they wanted the cash right up front. It wasn't that cheap. So what I went through, my husband had a good heart. Said that we can help a lot of women around the world, and then we can connect all the doctors each other, and then share the information or technology or their skills. That's how we started at the IBMS. But Hope Museum, I traveled 87 countries. You see poverty everywhere. It is amazing that mother have little children tag along and don't have much. And then you see woman had a breast cancer or like a female related cancers and all that. And then my main focus is education for the girls, little girls. I think it's so important how we educate, not just intellectually only, like to be kind, to be caring, to be a really good woman. That's the foundation of a household. You boil the children and raise the children, and then that children go out and become somebody's spouse and make another household in society and community and becomes the country. So I think that we have to care for women's education and health, and then science, art, history. We all looking through it. I am so eager to help. Anybody can, need help, but we don't have a facility. I think in America, where I live, this generous lady, Angela, wanted to contribute the land by the ocean. That's
The-
how we started it really strongly. But somehow this is in litigation now. But we are still dreaming to build a museum that around the world, any woman desperately need help, they can contact us. We can try to help them. So that's our dream. So
And what I remember of this about a year ago, so it was a very special event. It was at the banquet facilities at Tampa International Airport. And there were very prominent women and men and doctors from all over the world that were there, sort of as a kickoff. And you spoke very eloquently about the mission and the goal of the Hope Museum. And you've acquired over these past months, I guess, a following and support base because every time you and Dr. Kalin have a conference, for IBMS, the International Board of Medicine and Surgery, you bring in other doctors, whether India or Colombia, South America, in South Africa and South America also. These are special physicians and bring in facilities that can contribute for the benefit of the doctor-patient relationship that you're trying to promote and bring about special care for people, for women and their families in villages and towns and cities all over the world. And when you have these, I guess every year you have probably 2 or 3, 4 conferences and you work on the certification so that people are getting the medical treatment, can feel confident that the doctors and the facility and the clinics are certified. That's what Dr. Kalin has provided a level of confidence for the healthcare and the procedures all over the world that you're working with him.
yes, my husband doing a very good job, but it's not easy job. He goes around the world and then connect the doctors or share the information or share the relationship. And in human beings, it's really come down to the relationship you build with each other. But my husband adamantly care about one human, one world, one health. So we should all connect each other to help anybody if you need help desperately. So that's what my husband doing. But my involvement is only Hope Museum, but it's only dream right now. A lot of board members who got involved with it, and they all disappeared or given up.
They're all
So
over the place doing
so
things.
we need a person like Mrs. Melinda Gates. For instance, she really strongly care for women's well-being, and she does an amazing job around the world. Someone like that. So, or someone like Dr. Patel in Tampa area. She donates a lot of art, centers and medical schools and stuff like that. Unfortunately, my husband, me, we don't have a financial, goodness to, spread out to everybody. So we need a board members to work on fundraising and going forward with this dream.
And it's also under a 501c3, so it's a nonprofit. And you're right, you've spent a lot of time and hours reaching out, and I know, and I've seen this. Dr. Kalin has provided videos and the outreach all over the place. Matter of fact, you opened up some special administrative and health cooperation between Cuba over the past few years. You visited that a few times and worked with their administrators and the clinics and made some inroads. And that's what you do best. And it takes a lot of work, a lot of time, and a lot of money. And that's why you're reaching out for other prominent people, other people that can contribute uh, whatever resources you need to get the mission accomplished: one human, one world, one health. And we'll provide, and Dr. David is working on uploading some of the videos and where they can reach you if they have any information they want to submit or support they can provide.
Okay. Me is HYONKALIN. My phone number is 813-453-1762. My email address is hyunkailin, HYONKALIN @gmail.com. And my husband's, Dr. David Kalin's email is drkailin @drkailin.com.
And the telephone number for David would be
Telephone number is 813-966-1431. We need anybody who care about women in this world or in America or in my neighborhood. So we needed to get together, power up all the women's power to help around the world. Anybody, woman or child, or they need help, we can help. So please contact with us. Let's go forward with this dream, and we can make this world most beautiful world.
and more healthier and more safe. And we will be providing, and as you know, and Dr. David, I'm working with them in fundraising to get the message out, and we'll let these people know when there are follow-up activities and how they can get involved. That's so important to get involved. So we'll have other podcasts and YouTubes, and we'll let you know. But let the word go forth that IBMS, the Hope Museum Initiative, the Hope Museum Initiative, where women defines our world. We know that they shaped us throughout our lives. They deserve a place of care, of wonder, of beauty, of hope. And that's what the Hope Museum for every generation provides. Thank you all. God bless. And we hope to be talking with you on some positive things in the very near future. This is Bill Sefakar.
Thank you very much. This is Hyun Kailin.
Thank you so much, Hyo.